now live. You can go ahead.
Okay. Good afternoon, everybody, and thank you for joining us today. I'm Paul Gullickson, Communications Manager for Sonoma County, and this is our COVID update for Wednesday, June 29th. Let's begin, as always, with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Paul Gullickson.
Thank you, Gilbert. So we have a number of updates for you today on the COVID front. First, as our health officer, Dr. Sundari Mace, will address shortly, we are still seeing a lot of transmission of COVID throughout our community, and our case rate is high, although it has been plateauing over the last few weeks. While we're not seeing the severe outcomes, such as hospitalizations and deaths that we've experienced during previous waves of the pandemic, people are still testing positive. And we remain concerned, obviously, because we recognize that just testing positive is having an impact on the lives of many of our residents. As it forces people to miss work, cancel summer plans, and isolate from loved ones, sometimes in our own homes. The second development we want to go over today is the recent approval of vaccine for our youngest children. Federal regulators last week finally approved vaccines for children 6 months to 4 years old. These are the last age group and are to be covered by our successful vaccination campaign. Our vaccine chief, Dr. Umala Shende, will talk about that in just a little bit and let you know where you can get vaccines for your youngest family members. But before we get into any of those areas, we first want to talk with you about the transition that is occurring within the county's COVID response unit. At the beginning of the pandemic, we assembled a massive team of highly capable experts in disease control, vaccines, and logistics. Much of that response was funded through federal grants, money that will be running out at the end of this month. As we look toward this moving into the endemic phase of COVID, we, along with many other counties, all counties and states, are beginning to reform, re-strategize, and to some degree, scale back on our emergency response, while at the same time, we seek to retain much of the institutional knowledge and community partnerships that we've developed over the last 2 years. To address this transition in more detail, we are very pleased to have with us today Tina Rivera, Director of the Department of Health Services, and Dr. Gabriel Kaplan, Director of the Public Health Division within the Department of Health Services. We'll first start with Tina. Tina?
Thank you, Paul. I'll let Gabe bring up our slide presentation. Thank you, Gabriel. And you can turn to our overview slide, please. And what we'll be sharing with you today is specifically our plans for the future of our COVID work, what the transition of this response will look like. We'll be discussing how equity and the community voice will become a longer-term part of our department's work. And then we'll engage in some conversation about the next layers of the work that lays ahead for us. And I just want to share by saying that the magnitude and the duration of the COVID-19 response is far beyond any health emergency that we have ever faced previously before. But it's provided us with many challenges. On the flip side of that, it's also provided us with many opportunities for us to learn. It's highlighted our need to apply a health equity lens while implementing disease prevention and control strategies. And I believe that this pandemic has daylighted the inequities on marginalized communities more than any other disaster. And it's helping us to shift the way that we respond to future disasters. Next slide. So what does the future look like? How will we chart the future moving forward? Well, as Paul mentioned, COVID is endemic. It's part of our health landscape now. It's going to require that we continue to strictly monitor what's going on. We're really blessed to have a team of skilled epidemiologists who will help us to do that moving forward. We will expect continued cycles of mutation and spread of this virus, but we will continue to strictly monitor that. If there may be needs or times of surge, and we'll be prepared for that if we need to pivot or change. COVID will become part, as I mentioned, of our ongoing everyday work. So we'll make changes with respect to that. We see high levels of protection within our community, with 86% of our population that's vaccinated now. Now what's happening, there are decreased resources. So what we have to do is we have to organize ourselves appropriately, and we have to look at things more realistically. How can we continue to respond and transition this response in a way while balancing the resources that we have now? We will continue to ensure that we focus on those within our population who still face the greatest threats from infection. You know, I love what Dr. Irma Lashinde mentioned a couple of days ago in some email communication, that we've been able to narrow the disparity gap in our vaccine distribution and rates during the course of this pandemic. And we have narrowed this gap, and it's never been so small throughout the efforts of this pandemic as it is today. So we were very proud of the work that we've been able to achieve, and we want to ensure that as we chart our course moving forward, that we memorialize the great work that's been done and the progress that we've been made. So with respect to that, we've got a lot of people that we want to thank. To all those who've helped respond to this pandemic, our health equity work group, who helped to hold us accountable during the entire course of this pandemic, and who will continue to do that, who helped to create our equity framework. We are so grateful for that. The promotores and our community health workers, our hospital partners, our community-based organizations, our county employees, our city partners, our federally qualified health centers. We are so grateful. We're so proud to be a part of all of this work that has gone on. And there's so much for all of us to collectively be proud of with respect to all of the work that's gone on with respect to this COVID response and the vaccine rollout. The low number of deaths and hospitalizations, the county's commitment to embedding equity and fairness at the heart of this response. It's going to be very, very difficult, and has been difficult, to say goodbye and thank you to a number of our emergency extra help staff. But we want to acknowledge those from our community who have informed our efforts and who have spoke up so bravely and so courageously on behalf of those who have often been ignored by our response systems. And there's so much more that we could go on and on, but we're so thankful. Next slide. And so we want to acknowledge that community engagement and those voices will be critical as we move forward with respect to how we embed our work and ensure that it's a part of our programmatic areas moving forward. Our commitment to equity and to serving those within our community who are vulnerable is unwavering, and it is renewed, and this work will continue. We are so excited that we now have a department-wide equity manager and staff soon to be hired and recruited for. So we are excited that that work will continue and move forward. And we're looking to create multiple avenues of involvement and mechanisms for to continue and to engage with our community, rather than just one that's focused on COVID only. So moving forward, equity is going to continue to be layered in all of our ongoing work. And with that, I'm going to turn it on over to Gabriel to continue moving forward into our the details of what we will do moving forward in the future.
Thanks, Tina. Appreciate that. So my name is Gabriel Kaplan, and I am the new Public Health Division Director in the Department of Health Services. And what I'd like to share with you today are the plans for the department as we move into this next phase of our battle against COVID in our community. So the key point here is that our response is changing. We are breaking the existing COVID team, which has been quite large throughout the pandemic, into breaking those into their components and incorporating them into existing sections of the public health department that engage in similar work. Part of the reason that we're doing this is that, as Tina indicated, COVID appears to be here to stay, and it appears to be an ongoing public health problem that we're going to need to adapt to. The second thing is that we have a drastic reduction in the funds, and the emergency funds have been made available to us by the state and federal government for our COVID response. And so as the funding constricts and contracts, we have to narrow and focus our efforts accordingly. And what we do take comfort in is that our evolution is going to be reflective of the ways in which COVID has taught us and impacted our functions in our department to make us more outward facing, to make us more connected and tied to components of the community. And that will be a key principle underlying the work as we move forward. Our big challenge as we planned for this was achieving fiscal clarity. We didn't know what the fiscal picture was going to look like in the coming year, and to some extent, we still don't. There is relief money that is intended for the CDC and for states and counties, which is tied up in the US Congress and was expected to be part of a relief package some months ago, but hasn't moved forward and it appears to be stuck in the Senate. In addition, the governor has allocated additional emergency funding and now asked for ongoing funding for public health, which is actually a first in this state. We now have dedicated general funding for public health. That is part of his new budget, but we don't know when that money will come online and when it will be made available to the county and the form in which it will take. So we've had to budget conservatively based on what we know is available. And currently we think that's roughly about $5 to $7 million, which we'll have to cover the costs of all of our COVID work, which includes our testing, our vaccine operations, and the community support that we've provided. Now, we're hoping to get some greater clarity as we close our books on the fiscal year, which ends June 30th. We'll have about 45 days to collect invoices from our vendors and pay our bills and figure out whether or not the federal government will allow us to transfer unspent money to next year. So this is unlikely to be our final word. But for now, we had to budget conservatively according to what we knew was going to be available. But we have a plan as more money becomes available, if it comes forth from the federal government, to expand our operations as resources come online. And so we have several scenarios for expanded funding and know exactly how we're going to grow and which components of our responses will be able to grow and how they'll grow. However, the reduced fundings that we're going to start the year with do require us to focus the response on particular populations that in this stage of the pandemic appear to be most exposed to poor outcomes from infection. Those groups include the elderly, people above 60, 65 tend to do more poorly with infection, even if they've had a booster or prior infection. The immunocompromised appear to struggle sometimes to mount an effective immune response, even in the wake of vaccination. And we know that there are groups of our population that live in settings where they're far more likely to be exposed to the virus and far more likely to get a heavy dosing of their exposure to the virus. That includes people in congregate settings, such as skilled nursing facilities, people who are unsheltered, people who are living in incarceration facilities. So part of our key strategy will involve in protecting those populations, and also to think about who could potentially slip through the cracks of the medical system. We know that much of the response is going to be shifted from public health to our healthcare system. People will be going to their providers for testing, they'll go to their providers for vaccines, and they will in many cases go to their providers for new monoclonal antibodies and other therapeutics that have been shown to be effective in treating this disease and preventing poor outcomes. However, we know that there are many people who don't have insurance and who remain exposed and outside of the healthcare system. And so those are our particular charge as public health professionals, to look after them and to make sure they get connected to the care that they need. We have seen that most people, as Tina indicated, in our communities are protected from the worst outcomes of the virus. Despite a pretty significant surge in cases over the last few months, we haven't seen a concomitant increase in the number of hospitalizations and in the number of deaths, as we saw in earlier waves, such as with Delta and Omicron. So we've taken comfort in that. And we know that, as Tina said, 86% of all our population in the county has received at least one dose of the vaccine. And we know a good number of us have also been infected by this disease. And so we've mounted antibodies from that experience as well. And so we think that a good deal of people have some degree of protection, but there are still individuals who are not able to mount that level of protection. And we need to look out for them, both as public health professionals and as a community. Part of that is to monitor outbreaks and infection in the community. We'll be taking our testing and infection control group from our COVID response and merging them into our disease control unit. They will, moving onwards, provide guidance, training, supplies, and assistance to settings where the most vulnerable individuals that we talked about, people who are most prone to potentially poor outcomes from this disease, would gather. Those would be long-term care facilities, skilled nursing facilities, residential care for the elderly, people in shelters, people in jails. And in addition, we want to provide outbreak control within schools, because we know schools are a very common place where diseases spread and spread rapidly. And those students bring those diseases home to more vulnerable members of their family. So we're going to make rapid tests available to the community from DHS. People can reach out through community-based organizations to us. We are going to publicize more broadly that there are early treatments that are available, these monoclonal antibodies, which can be made available to people who have an infection and who are at risk of not having a vigorous immune response to that infection. And they've been shown to be very effective. And we are working in concert with the hospitals and with the clinics in the county to make sure that those treatments are available to people in this community. We also are inviting community-based organizations who are concerned about the members of the community and their access to testing to volunteer to become a site for the California Testing Task Force. And this website is available at testing.covid19.ca.gov/get-started. And that's a great place for a community-based organization to sign up to become a community location where people can come to get tested, receive support, and the state will provide the testing materials and training necessary for you to set up and expand testing capability within the community. In addition, we've got our vaccine group, which is going to be moved into our public health preparedness section. The COVID planning and operations and vaccine planning and operations group will become part of that section. We're going to continue to seek equity and parity in vaccination rates. We're going to continue to try to get people who haven't yet chosen to get this vaccine to adopt it. We've seen lower rates of adoption in those under 50, and so that will be a population that we continue to keep an eye on. But we're also going to focus on the up-to-date status of those who are most susceptible to serious illness. So that would include older adults, and watching as the vaccine recommendations evolve over time. And if a new vaccine becomes available, making that available to those in the community who need access to it first. One thing that we do want to continue to do is make ourselves available through community outreach and engagement. And so we've constructed a special team that is part of this COVID response that will become integrated into the health department. We're going to support 7 community health workers to expand COVID education in our communities, to continue to develop relationships with communities, to help understand their needs, to match resources where they're available to those needs, and create better channels of communication, in particular, again, with those who are most vulnerable within our communities. So we're looking through this to make available response testing, pop-up testing, making it available in locations where communities particularly feel that an outbreak is growing or they need access to it, pop-up vaccine locations, providing navigation and liaisons at testing and vaccination sites, and continuing to do ongoing outreach, information, distribution, education, and such. One thing that we are having to share with everybody is that the avenues of emergency financial assistance, which were made available through the CURA project through DHS, will be ending on June 30th. Now, CURA is not going away. They're forging a new partnership with Human Services. Their services, as we move forward, may look different. And we know that the assistance levels that they will have available to them may be a little bit reduced. And so we don't know exactly the form they'll take, but we do know it's going to be a part of the community's COVID response. It's just not going to be a continuing part of DHS's community response. So as we look into the months ahead, what I do want to share with you are the principles of what we've learned from COVID, what we want to integrate into all of our public health work, and what will continue to be the pinnacle and the pillar and the foundation of the COVID work that we have done so far in this county. The first is to use the resources that we still have available to us through the federal government and state to expand public health capacity and responsiveness for the long term. What we've seen in this county over the last 5 years is that we are a crossroads for multiple disasters. We've experienced fire, flood, pandemic, and we need to be ready as a public health department and as a county government to be responsive to the needs of the community as these disasters or emergencies come upon us. And so expanding capacity for that is going to be critical. We're going to look to expand our capacity in areas of preparedness, in disease control, and in the provision of community support. We're going to continue to build models of community voice and engagement into our work. We're going to be looking to integrate the best of our COVID work into all of our areas. We're going to look to break down the silos between our programs and look for connections that naturally exist. For instance, we do work with communities to prevent tobacco use, to prevent the use of alcohol and other substance abuse. Well, what we've seen is that communities with low levels of resilience are most prone to adopting those risky behaviors. Those are the same communities that are vulnerable to disaster. And so strengthening community resilience and providing resources to the community for self-efficacy and for autonomy and self-reliance, being able to lift the communities up and strengthen them is going to be a critical part of our mission. If we're going to do that, we have to do that by breaking down all the silos between us and working together. And so we want to break down the walls between ourselves and also the walls between ourselves and our communities. So community communication and communication with the community and seeking direction from the community will be an ongoing part of our work. And that's it for our presentation, Paul. Thank you so much.
Great. Thank you, Dr. Kaplan, and thank you, Director Rivera, for that important overview of the changes that are underway in the COVID response. We know you'll have more updates for us in the weeks ahead as we move forward. Next, we will go to Dr. Mace, our health officer, for an update on our current COVID situation, including our case rate. And after that, we will turn to Dr. Urmila Shende, our vaccine chief, who we regret to say is among those who will be leaving us at the end of this month due to the transitions that are underway. And as many of you know, Dr. Shende is one of the local experts that we have leaned on so heavily over the past 2 years. And in particular, once the vaccine arrived in Sonoma County in December of 2020. she has played a pivotal role in the success of our local vaccination campaign. One that has distributed more than 1 million doses locally and fully vaccinated roughly 4 out of every 5 Sonoma County residents at this point. And I should add, of the 58 counties in the state of California, we continue to have the 9th highest rate of vaccination. So we just want to publicly thank her for all that she has done for the county. Before we hear from Dr. Shinde, let's start with Dr. Mace for an update on our COVID cases.
Great, thank you so much, Paul. First, let me reiterate that we're still seeing a lot of transmission occurring in our community of COVID-19. But unlike surges we've seen in the past, we aren't seeing the really negative outcomes, such as increased hospitalizations that can impact our hospital capacity or an increase in deaths. I am gonna share my screen now and share some data that we have. 1 second. See whether I'm able to share my screen. Are you now seeing my screen? Great.
Yeah, you can put it, you can start the slideshow. There you go.
There we go. Yeah, presentation mode's perfect. So as you can see here, we still have high case rates. You can see that our new cases per 100,000 residents per day has kind of remained in sort of the 30 to 40 range over the past several weeks. Our metrics as of today are 37.9 new cases per day per 100,000 residents. And our test positivity has been slowly but steadily climbing up, as you can see here. And today it's 15.3% overall test positivity and 17.4% positivity in our lowest HPI quartile. What this means is that we have a lot of community transmission happening, and we're probably not detecting all of the cases that are occurring in the county simply because a lot of people are now using antigen testing and testing at home and not reporting. However, the good news is our hospitalizations have really remained quite stable, and I've not heard from our hospital partners that they are at capacity or that there's any risk at this time. And although 72 people have died from COVID since January 1st, we've had very few deaths over the past several months. If you look at us compared to the Bay Area, and that is, you look at Bay Area rates as well as state of California, you can see that the Bay Area and the state of California, the Bay Area and Sonoma County are higher than the overall state of California. And that's been the way for some time now. Sonoma County case rates are slightly lower than the Bay Area region overall, looking from March to present. And we're right smack in the middle when it comes to where we are amongst other Bay Area counties. A few are lower and several are higher, but we're with the pack. And so everybody in our region is seeing the same case rates at this point. The really great news is our vaccination status. And as I think others have mentioned, you know, we have now 83% of the total Sonoma County population at least partially vaccinated. And that's actually 77% fully, 6% partially, but this reflects the entire population at this point. And that's why these rates seem a little lower than what we had been representing before. But if you look by age group, we have done really well in vaccinating those in the older age groups, especially our very vulnerable elderly population. And we're still working really hard to catch up on the kids. And that's where we see a little lower vaccination rates, especially in the 5 to 11 a year population. And as Dr. Shinde is probably going to talk about, we have started vaccinating the really young kids. That would be the 6-month to 5-year-old population. And by race ethnicity, you can see we still have some disparities in the percent of vaccinated, especially in the Latinx population compared to the white population and the overall. But we are working very hard for equity. I'm going to stop sharing the slides now. And as I said, I've already given all of our data. We are not at this point considering a return to health orders or restrictions because, as I stated, we're not really seeing the worst outcomes. Our deaths have been extremely low, although we've had outbreaks even amongst some of our skilled nursing facilities. We haven't seen the really negative outcomes. And this is largely due to the fact that we've been so successful with our vaccination campaign. The recommended health guidelines are the same as they've always been, that I've always reiterated. I still strongly encourage everyone to continue wearing their masks in indoor public settings, especially with large groups of people gathered close together. It's especially important for protecting those who are elderly and who are immunocompromised. High quality surgical or N95 masks are still strongly recommended. We know that many people want to gather this summer, especially around the 4th of July holiday. And it's very important that we celebrate safely and that people do what they think is important for themselves and their families and their community. I continue to encourage you to get tested if you have symptoms or have been exposed to a COVID positive person. And if you test positive on an at-home antigen test, please do report the results to the county by going to the county's website at socoemergency.org and find the COVID testing page. At the top of the COVID testing page, you'll find a link to a form for self-reporting your at-home antigen test results. Finally, the most important thing you can do, if you haven't done so yet, is to get vaccinated against COVID. And if you're eligible, get your booster shot. If you have children in the under 5 category, get them vaccinated. It's their turn now. One thing we know for sure is that vaccines work, boosters work, and they have been a critical tool in our community's overall ability to return to normal life while COVID still exists. Those who are unvaccinated in Sonoma County are not only much more likely to get COVID, but they're 18 times more likely to end up in the hospital, 13 times more likely to lose their life if they end up getting sick. The main reason we're not seeing the high rate of hospitalizations and deaths is because of the availability of vaccines and boosters. Now I'm going to turn this over to Dr. Shende, and I want to also reiterate how indebted we are to her service over the past 2 years of the pandemic. She initially started on as a volunteer for 6 months, performing contact tracing at an essential time when we were training people to do contact tracing. Subsequent to that, she was able to jump into the effort as our vaccine chief, and it's due to her that we've been and her team and the entire vaccine team and the COVID section and our leaders in Department of Health Services that we've been so successful. So thank you, Dr. Shande. Let me turn this over to you.
Thank you, Dr. Mace. That's very kind of you. As Paul mentioned, the major development in our vaccine campaign was the approval earlier this month of vaccines for our youngest residents. Many parents are so relieved to finally have an option to vaccinate their children after keeping them isolated and working hard to prevent them from getting infected with COVID for so long. The vaccine is safe and it's effective. It gives hope to parents that their little ones and they can finally, again, have some sense of normalcy. The Pfizer-BioNTech vaccine is for children aged 6 months to 4 years old, and the Moderna vaccine is for children aged 6 months to 5 years old. The Pfizer vaccine is administered in 2 shots, 3 weeks apart, followed by a third dose at least 2 months later. Each of these doses is 1/10 the dose given to adults. Moderna's vaccine is a 2-shot series given 4 weeks apart, and it's a quarter of the adult dose. Kids under 5 years of age have had a 5 times higher rate of hospitalization with the recent Omicron surge than with prior variants, and 50% of those who are hospitalized had no underlying medical conditions. COVID is now the number 4 or 5 leading cause of death in the pediatric population under age 19, depending on which age group you look at under 19. So COVID does affect children, and vaccines will help to protect them. Parents who have healthcare coverage are encouraged to reach out to their primary care providers to find a vaccine appointment for their children as soon as possible. Vaccines for those aged 6 months and up are also available at our fixed vaccine clinic at Roseland Community Center in Santa Rosa. Appointments can be made on myturn.ca.gov, but walk-ups are welcome at the Roseland Clinic at 779 Sebastopol Road. Our vaccine campaign continues to make progress. Sonoma County now has, as mentioned before, the 9th highest vaccine rate of the 58 counties in California. Our mortality rate is 57% lower than the state average, and our case rate is 20% lower. As of today, a total of 387,909 Sonoma County residents aged 5 and up are fully vaccinated, which is equal to nearly 83% of our eligible population. Another 29,216 residents, or 6%, are partially vaccinated. Our Black population is 87% fully vaccinated, and our Native Hawaiian and Pacific Islander population is 84% fully vaccinated. Our Latinx population is 72% fully and 80% partially vaccinated. The vaccine is also available at most pharmacies, health clinics, and primary care providers. Wherever you go, the vaccine will be available at no cost to you or your children, regardless of your immigration status or whether you have health insurance. Walk-ups for first and second doses are accepted at most clinics and pharmacies. Residents can make appointments at the county's vaccine clinic page at socoemergency.org/vaccine or through the myturn.ca.gov website. I'd like to thank you all for what you have done to keep one another safe and to protect the most vulnerable among us. We have the 9th highest vaccine rate among the 58 counties, which is a testament to all of the hardworking healthcare providers and volunteers, and also to the willingness of our population to do the right thing and to get vaccinated, to follow health recommendations, and to get tested. Because of you, we have saved countless lives. Finally, I would also like to say that I've been honored to be able to be a part of this historic COVID effort. In the 24 years that I have lived in Sonoma County, there has never, in my memory, been such a sustained and successful community-wide effort that required a need to reach everyone in the community. I'm grateful to our leadership who allowed us to have autonomy and to be able to pivot as needed to meet the ever-changing needs of this vaccine effort. Thank you to our equity manager, Dania Candela, who ensured that equity was always at the forefront of our efforts. Thank you to Paul and the communications team for providing clear communications at every turn, be it through press briefings, video clips, or flyers for the community. I'm also grateful to Kate Pack and her amazing EPI team who helped to keep our decisions data focused. I'm so appreciative of our health officers. Dr. Baldwin has been the unsung hero throughout the COVID effort. Her work has kept this COVID and vaccine team running smoothly. And finally, deep gratitude to Dr. Mace, whose steadfast leadership has guided us through the many twists and turns of this pandemic. Thank you, Dr. Mace. And with that, I'll hand it over to you, Paul. Thank you.
Okay, thank you, Dr. Shinde. At this point, I'll ask our panelists if they have any other final thoughts before we sign off today. If not, I just want to thank you all for being here today. We are going to end the webinar portion of our session here. Thank you all again. I would also like to thank the crew who helped put this together today, including Anthony, our Spanish interpreter, and Odie, our ASL interpreter. For more information on the county's COVID response and our vaccination campaign, we encourage you all to go to socoemergency.org/vaccine. Where you can also find out information about making appointments, although walk-ups are available at our Roseland Clinic in particular. So with that, have a good week, everybody, and stay safe. Thank you.